All right, so it's working on Facebook now, right? Hi, Romana. Hi, Akhila. Hi, Ria. Hello, everybody. Yes, the you can message me the chat, and I will be answering your doubts here. All right, so you guys can see me. The live is working fine. Let me share my screen. So as you guys know that the purpose of meeting today is a very, very important discussion. I'll keep it very crisp, very sharp, very straightforward, and focusing and talking only about the strategy because I know you guys have started. We have started the week one plan, and now either you've joined now or you will be joining in few days. So you will have a backlog as well, and you will be starting the week two as well. So there is a lot to catch up. Those who are repeating the program or repeating the attempt in the March 25, please know that even if you join late, the most important thing is that you already have a very, very strong base and you have covered most important sources once, twice, thrice, more than multiple times, right? So the good thing is even if you join and start late, it doesn't matter. You will catch up very quickly because your syllabus is mostly prepared. Now, coming to the most crucial aspect, which is how to prepare for this exam, what is the latest strategy that we will be following, right? Ariana, the settings will be directing the messages to me. So send me your questions. All the questions, whatever are sent to me, I will be answering them. I would like to keep the questions towards the end part of the session. Let's discuss the strategy first and see what is going to be our approach in the coming 5 months till the March 18th when the exam officially happens, right? All right, just let me just check all the technicalities of the meeting. They're working fine, and then I'll start discussion. All right, perfect. Everything seems okay. You guys can see my screen. And before I reveal, I want you to know and wanted to show you the drive rearrangement that I have done. I sent you the screenshot yesterday on the group as well. So if you can see this drive link, I have rearranged. Can you all see my drive link screenshots this on the screen? So basically, I have now made on the main page, on the landing page, all the three important folders that you would be referring. The fourth folder, which I've already named not part of study plan, which means that this folder contains only the reference books, like all the textbooks of your BDS years, which are downloadable, so you can download it and keep it with you for your future studying and continuing education as well. And even during the preparation of part one, if you want to particularly refer any concept which individually you're having difficulty to understand, right? So these are just big reference books which are not to be read for the program, for the study plan, for the part one exam. Absolutely. We don't have time, and in 5 months you're preparing entire 5 year subjects, so there's absolutely no need. That's why I've named it, because a lot of people get confused. So I've kept the name very straightforward, not part of study plan, right? Coming to this is your study plan. So these are subject-wise articles. These are self-study books which are needed for study plan. You can see the elaborate name. Self-study books which are needed for study plan. So these are the guidelines and the books which you will be utilizing as part of your daily self-study plan. So these are self-study books. And then this is the success material, which are all the files that we have covered in the classes and which will be asked in the examination. So these are your 1,000 past papers are your 1,400. Then it contains your ODEL case list, which are the most important ODEL case articles. Then I've made the table of special topics and CV classes elaborating what articles are covered in under individual clinical vignette and special topic classes. Then your ultimate advanced file and the solid advanced file will be uploaded as we move along. Then I've kept the advanced file and the solved advanced file from the September for now, because I know a lot of people will be continuing and may rely till we solve the ultimate one. They might rely for the revision on the older one, right? So I've kept both the ones, but once we have come almost halfway in the ultimate advanced file, I will remove the advanced September file because it's more or less same with the added newer concepts for September 24 questions. So thousands and past papers both are given, unsolved and solved both folders are given separately. These are 1000 PDF, which means they are unsolved, and 1000 solved, which means it will contain the solved PDFs. Then the CV classes and CV articles are also are covered here. There are some perio extra classes which I have covered, extra lectures from the perio clinical cases in periodontics book, which are most relevant periodontics chapters and concepts which get asked in the exam. Then you have all the OPG error references, other references which are talked about in thousands and past papers. They are all here for the references. All the important articles are here as well, which are part of the references of the material. Along with that, the core quizzes that you take weekly. For the first 8 weeks, you take the core quizzes. Remember, have you seen on the study app as well? You've seen on the app also, right? Every week there is a core quiz of a particular subject that you take. So that quizzes explanation guidelines or documents are also shared in the weekly quiz feedbacks. Can you all make out? So endo core quiz feedback, operative core quiz, all the core quizzes, explanation to the answers are given in these documents. Now for the first week operative, yesterday, the first mock of the subject wise SBQ mock, individual subject wise, was also released yesterday. A lot of you already took it. You sent me the screenshots. If you're waiting to complete the study plan, I would also recommend to first finish your study plan of that week and only then take that subject wise mock. So I'm sure you enjoyed taking that and you've seen it. Now, moving every week onwards from now, you will get every subject's individual mock like yesterday. It will be released every Sunday. I would highly recommend to only take it once you have confidently and thoroughly completed your study plan of that subject of that week. If you have backlogs, you can hold on to take that subject wise mock. Am I making myself fully clear, guys? Because I don't want you to rush into things. I want you to first complete the study plan and then. Yes, Fabian, I'm going to show you the study plan also. I will be showing only first weeks as a sample, not the entire one, but I will be showing the first week as a sample. Now, when you go to this website, this is the only study plan that you have to follow, right? This is the only study plan. This is the current way of putting this study plan here. I'm redesigning it. I'm adding a lot of stuff, more elaboration, right? I will be adding more elaboration, more elements to this study plan, and it will be uploaded by today, later today, and it will replace it. So there is one study plan only. One study plan only. There is no 3 hour, 5 hour, 8 hour distinction. Highly recommendation comes for the preparation of this exam to minimum at least study 6 to 7 hours per day, right? And this study plan can be covered if you do 6 to 7 hours per day and some more hours during the free days of your week, whether it's weekend or in between the week, if you find that there is a backlog. First of all, very important point that I wanted to inform you. This is the study plan. There is one study plan for everybody. Can be done in 6 to 7 hours per day. Okay. And adding more hours if you are getting backlogs and if you have some free days, study more during those days. When you watch the 1000 MCQ classes and past paper classes, please do not make notes while you watch class. Don't pause it and start taking notes. A lot of people do that because a lot of people have told me that they continue to watch thousands and past papers, and they pause the class and they start making their own notes. Then you are automatically making your 4 hour plan into a 6 hour plan, right? So let's keep the questions towards the end. Because I don't want them to go and get lost. Let me tell everything, and then maybe your everything gets answered. So first of all, tell me, this happens when you do 1000 classes, when you do past paper classes or advanced file, whatever classes. Yes, Bashar, I know lot of people do that. I don't want you to stop the class and take notes. Consider that also, that it's a live class in a hall going on. Suppose you were attending a live class, would you stop the teacher and then take notes? No. So you will only keep your diary and pen, and you will only take notes, whatever you can immediately hear, and short notes, right? So first of all, when you start with your study plan and do the watching part of the webinar from the app, do not stop the classes. Exactly, Divyapreet. That is why I had to take this point in the first part of the session today. Do not stop the classes and take notes, because you are stretching your 6 to 7 hour plan to 13 hours, 12 hours per day. Do not do this. You watch it, and every class you will be revising, because whether you take notes or not, Shweta, you will not retain entirely from any session from the first year. And the next time you listen, you make it to 1.5x speed, right? All the classes I would recommend, Pragya, do not stop and pause to take notes. Only write notes what simultaneously you can while the class goes on, right? Simultaneously, you can write. I'm not denying that, don't make notes at all, but don't stop the class and make notes. You are not doing a thesis. And that is why you will make a 4 hour of a daily watching party into a 12-hour watch party. We don't want to do that. Is it clear for everybody? I want to assume that you all get this. Is a very crucial, and time management I want to teach you from the first day on, right? This is very crucial. Now, immediately when you stop pausing the classes and taking notes, you will see this is a 6 to 7 hour study plan only. You are going to do all the subject-wise articles in this study plan. This study plan covers all these subject-wise articles. Particular week, you will focus on individual subject folder. You will go open it, do all these subjects, all these articles. So if at all you have, say, about 28 and 30 articles per subject, and you have 7 days a week, so by doing 4 to 5 articles per day, you can complete the entire subject folder in 1 week. Yes. If you have 7 days in a week and say about 25 to 30 articles per subject, doing 4 articles as a self-study per day, you will be completing that entire subject in that week. And that's what you got to do. Whether you do it alone or you do it with a study partner, doesn't make a difference. Yes, doing with a study partner is helpful, is easier, is more retentive, and engagement is higher. And it's easier to not miss out things when you have a study partner, because some things you will notice, something they will notice, and together you will see better, right? So this is a part and a pillar of your preparation. The study plan is going to guide you every day. From this day on till the exam, the study plan is guiding you every day what you got to do. So reading an article is an art. Bashar, if you go to my CV classes and special topic classes, and you watch one CV class and I have covered maybe 2 or 3 articles in that class, you will learn the art of reading the articles in those classes. because you have to read through it, not thoroughly, but first read is a quick read of it. Every time you go and read from that particular paragraph or something, immediately you will know a clinically important information. Because you don't have to learn or memorize the epidemiology, the study reports from various studies, but the discussion part, which is given in the end, tables which are given in the articles, they are important, right? So if you go through a paragraph and it talks about this study was conducted and they found this study was conducted, they found this, you can't learn from that part because it talks about various studies and it always has varied results. But in the conclusion, they give a literature review. What is a literature review? Which is after outcome of all the studies and cohorts. Is that correct? We have done that. Remember, the most accurate source of information comes from the literature review. So after every article's end part, you will have that discussion and a conclusion where the literature review will be given to you. And during, if there's a case report in an article, it will help you understand the chief complaint, various guidelines around with it, what treatment plan was suggested, various scenarios. And every Monday now, Bashar, I will be doing new articles with you guys on the public sessions, right? Our articles are our strength. And every Monday, I will continue to do some more important articles, which are not even in the subject wise. I'm finding the latest Australian articles based on which the questions are coming in the exam, and I will cover those with you every Monday classes on public sessions. So during that also, you will learn the art of finding information from the articles. Yes, some articles which are highlighted, only read the highlighted part, those ones. Right? So weekly, I will keep you accountable for the article grasp so that I do every Monday an article with you on the Monday class, right? That will inspire you and motivate you to do the self-study on the articles every week also. Now, the self-study books are also to be done every week. Every week, you must have seen, like operative, I've mentioned Sturdivant, some chapters to be done. Then the trauma guidelines are in the some of the in pedo week, trauma guidelines are to be read, right? Then in some weeks, you have to read your Cameron in pedo week again. In radiographic week, you have to do some chapters from Langley's. Then Odell cases also you have to watch every day. So I've marked it Odell new and Odell old because old is the third edition and fourth is the new edition. And our 49 case selection is hand-picked case selection from these two very important editions. White and Faro, I have made you do in 1 week study plan where I have made you observe all the x-rays on it. And mind you, you will get an x-ray mock in this particular preparation course also. When you have practiced all the white and furrow radiographs, after that, in the month of January, I will be giving you x-ray practicing tests also. Are you ready for it and are you excited for it? So these are the strategies that are you will be applying and will be coming your way. But this is now the compilation of all the books. So I've only handpicked. You don't have to go into that important guidelines and folder and everything. Now I have made everything narrowed for you. So you see, it's all the books that you need for the study plan just under one folder, one place. Okay. Now, so success material is all the files. Study books, self-study books are all the books that you will need, and subject-wise articles are the articles that you will need to be studying on a daily basis. These are the three folders. Everybody got it? The drive link is completely sorted for you. Now let's look at this. This study plan is the older version, which is going to be replaced with the latest version. I'm going to give you a preview of what you will be doing. What is our winning strategy now? Right? And those who are asking, I can't do 5 hours, I can't do 3 hours, I can't do. First of all, you have to realize this is a competitive exam. Everybody is preparing similarly, studying the same resources, studying the same books. Everybody knows the syllabus. Everybody knows the policies and guidelines. Everything is out there. Nothing is hidden. ADC doesn't keep anything hidden or wraps. They give you all the important materials to study because they know that you're not practicing in Australia already, that you would know it, right? And you're not going to ask a practitioner there. Nobody, and a practitioner also ideally is not performing these guidelines or policies absolutely, right? So they know the overseas dentist is outside the country. He's not in Australia. He has to learn the information through the documents, through the guidelines, and not from some random clinician practicing there, right? If a random practitioner in Australia was equipped to give you all this information, there would be no APRA, there would be no mandatory notification and mistakes and complaint section in ADC. If every ADC registered practitioner was perfectly practicing, APRA wouldn't be there to monitor their mistakes. And these policies wouldn't be there to help them know what to do ideally. This exam requires research, not an Australian clinician to teach you. And the research comes from the policies. You need a mentor who can highlight and teach you the policies and help you retain that in the exam. That's what mentorship for ADC Part 1 means and needs. Get yourself completely clear in what you need from a program. I hope I'm making full sense for everybody. What you need. Don't go about asking. Some people who say that they're working as DA, it can help them. But the most A's, and if you watch the success celebration class, Sunaina was in India, right? And Pooja was in India. A lot of 50% of the candidates who cleared were in India, doing their routine practice there or just freshly pass out. That means that part 1 is a completely academic exam. Clear for everybody or not? I want to emphasize and give you a third and distant perspective so that there's a lot of confusion going on. Everybody is saying something or the other. So you either get into that noise and get distracted, or you get specific, clear that those who cleared 50% or maybe more were outside Australia, and it's an academic exam. If they were working as DA, it may have given them some advantage of maybe give application of those concepts, understanding the clinical relevance of them. But that doesn't mean that your imagination will not allow you to do. God has given you a beautiful gift to imagine what you have not been practicing yet. Is that right? If only the internal Australian DAs were to be clearing this exam would not be open for entire world, and the centers would not be in entire world as it is. This is a purely academic and a very, very intense exam. You need to work as a scholar. Scholars will clear this exam. So you have to study like a scholar. If you have less time, message me. I help you take out the hours. Everybody has got 24 hours in a day, but I understand being a mom that we moms literally are working 48 hours in 24 hours. I know that myself. But I'll help you how to take out the time and how to prioritize, and sometimes I'll give you hacks and some hacks to do the same plan but in lesser time. Like when I told you now that you're not making notes by watching the class, you already created a hack. You're saving up your time. Waking up maybe an hour early than your usual time. And, studying when your kids are asleep, utilizing the time of peace. Because if you're trying to study when there is distraction and there is sounds and noise, versus studying when there is no distraction, no sounds, your entire family is sleeping, the what you do in 2 hours, and when you're distracted you can't do even that much in 4 hours. So a focus bubble is also important. Sometimes you can achieve in 2 hours if they are completely focused, and you can study whole day 4 hours and you cannot get productivity out of it. And you must have experienced it in your own ways, that how focused you were. Hours don't matter. It's your focus that decides how much you can gain in 6 to 7 hours. When I say in 6 to 7 hours, every hour has to be a productive hour here. Now let's talk about the 5 most important pillars of Winspert's winning strategy, because we have heard the winners talk in our success celebration class on the Saturday. And considering that, going through everything, whatever we were having discussions on the group, I have formulated these very important 5 pillars that you will be relying upon on a daily basis. So first part of the pillar would be watching the daily classes from the app, right? This will all these 5 pillars are covered in the study plan. I'll go and change the slide and you will see the study plan sample also, those who were asking. So you see, watching daily classes from the app, whether it's the thousands or past papers. And if you have any suspicion about thousand and past papers, go watch the success celebration class again. Don't take my word for it. Take the word of candidates who cleared it, that how watching the thousands and past papers gave them such core knowledge. Like if you see, if you watch Jamil's, Hamza Jamil's interview on the success celebration class, he clearly said that he spent last few weeks just doing and knowing by heart thousands and past papers and advanced file and mega master. If you have watched the success celebration and if you heard Hamza talk, he got all the 4 A's. And similarly, Sandeep and Annie and everybody who did this, they said that thousands and past papers gave them that strong base that exam did not even feel difficult for them. They said that we didn't even realize that exam was tough. Reason being, they prepared the classes so well. So these thousands and past papers, and if you have watched my classes, thousands and past papers, every page, every question that I have discussed is loaded with gems of information and concepts. If you have watched them, some of them already, they are so intense, loaded with knowledge. So watching daily classes from app as given in your weekly plan will be the first pillar of your daily preparation. Then after you have completed watching the daily classes from app, you have a 2 to 3 hour self-study plan given in the study plan using either the book which is mentioned under that week or the subject-wise articles mentioned under each weekly study plan. Is the second point clear for everybody? I will be showing you as an example also. But every day you will be watching the classes from the app, which will be given to you. I'll show you the app also. I'll show you the sub-study plan also, self-study plan also. After doing these 2 things, simultaneously, the third pillar of your daily preparation would be revising the ultimate advanced file classes that go on every week and also revising all the books that you are reading. All the books, TG, Odell, you also start once you complete it, you also will start its daily revision. Like maybe 5 pages a day, maybe 10 pages a day. This revision will regularly start. Number 3 is clear. It is extra than your 2 to 3 hour article and book plan. When taking a weekly and a monthly mock as and when released and required, you are informed prior and it will be mentioned on your study plan also that this week you have this mock, go and take this. So up to 15 weeks, you have a weekly mock. Every month you have your ninja mock. In the end, you will have grand mocks. And in the middle of the course, you will have infection control guideline mocks and your X-ray practice tests. It's all planned and laid out for you to just come and work on it. That's all. Now, fifth pillar that you're relying on is remember, I always tell you 30 to 40 minutes of self-assessment Open the unsolved thousands, unsolved past papers, unsolved Mega Master, unsolved Ultimate Advanced file. It can be any of this file on a daily basis. When you're starting out, it should be thousands and past papers. And when you're after week 9 or 10, you should start with the Mega Master. And then after week 15, 16, the Ultimate Advanced file. It doesn't matter. Just pick a file that your heart wants to do. I want to give you that freedom. But 30 to 40 minutes every day, you will do a self assessment. You will solve thousands or past papers or Mega Master or Ultimate Advanced for 30 to 40 minutes. Maybe you do 30 to 40 minutes means just do 30 questions every day from any of these files, aiming to achieve at least 95% score in each of these sources. First time every day, when you take a 30 question test, you might get 60% right. Is that right? Next day you will take it, you will get at 70. Next day, again you take it, you get at 80. Keep repeating these self-assessment tests till the time in all these four sources, individual questions, you should reach 95% at least in your self-assessment every day. You should get one journal, completely new journal, like a blank journal, and dedicate it for your self assessment every day. Every day you will open a file, unsolved file, open your journal, write down number 1 to 30, keep your answers, open the solved file, check yourself. 30 to 40 minutes every day you started. And start from now, from day one. Don't wait for the self assessment when you have done the program or done the syllabus, because 1000 you're doing now, so you can start assessing 1000 right now. There is no need to wait for you can wait for Mega Master and Ultimate Advanced file when it comes, but for now you have started with 1000 and past papers subject wise, so you start self assessing on these files yourself right away, and keep repeating till you reach 95% of the score in each of these files. Am I making myself fully clear? This is your secret sauce to success. These 5 pillars will take and carry your success, not just here, but because this method of studying and learning in these 5 months will train you for your part 2, will give you that resilience, will give you that endurance for the pressure that part 2 brings with it. Mega Master will come in the study plan on week 9. Up till week 8, you are doing the subjects individually along with their subject-wise thousands and past papers. Ultimate Advanced file we have already started, and we are doing it along every week on Wednesdays and Fridays. Mondays, we will be doing the public session on important ADC articles. Am I making myself fully clear what we are doing in the live classes also? And the public session, and the Wednesday and Friday is the Ultimate Advanced file. And you will revise the live classes that I'm taking on Wednesdays and Fridays, especially over the weekend. And you don't, so if the live class is 1.5 hour to 2 hour, you watch it on 1.5x for revision. Got it? You just speed it up at 1.5x if you're watching it the second time. The second time watch should be on the 1.5x. Yes. 1.5x is another hack, but a very important hack. Remember Nadia's message on the group, everybody? Remember Nadia's message? Don't forget the winner's messages. Don't forget what they are giving you. They are the breadcrumbs leading to success. They are your peers. I know we have mixed emotions. We studied the same, they cleared, we couldn't. This exam was set differently with a different aim mindset by ADC. We don't know what is the underlying reason for this crashed pass rate. We don't know that. We can't control it. What you can't control, move beyond it. Can you control how ADC thinks? Can you control what the CEO wants the number of people to enter his country? Can you control any of it? What the cutoff for information gathering cluster would be, the cutoff for individual cluster, what it would be, whether they'll fail most in information. Can you control any of it? What you can control is these 5 daily dedicated preparation and strategy to be applied on a regular basis, being sincere to yourself. Don't lie to yourself. Sitting in front of screen 7 to 8 hours a day, sincere 6 to 7 hours per day. Sincere effort and a plain effort is also different, right? We are all adults here. We differentiate and understand what can be an effort and what can be a very sincere and a hard effort on a daily basis, a dedicated from the heart, making sure you protect. So Hamza gave an important insight. He used to be working and he had the app access on his phone, so he would just plug in his AirPods and listen to the sessions even while working, right? You're commuting, maybe make your device as your phone or your tablet, which you can carry while commuting, and hear the classes on the go. Save the time, get more productivity out of your day. Again, another important hack. Maybe you're a woman who cooks for a family. Beautiful. You're cooking in the kitchen, making your recipe. Please plug your AirPods on, hear the class while you do that, right? So, club your hearing the classes during your chores also. You can do that. And then particular focus bubbles of time when you're alone, you're not doing anything, it's your dedicated study time. Do the 2 to 3 hour self-study plan. Do the self-assessment solving. Take your mocks. Revise the live classes. Revise the important guidelines during that time. Watching daily classes and revision of the live classes from the app can be done on the go also, right? I do not want you to make notes because I repeat myself in every lecture. I repeat and reiterate and I give you. Ever do I tell you, oh, that's on that file? Don't ask me that. Whenever you send me doubts on WhatsApp, I still explain, even if I've explained it in the classes. So I will repeat myself, I will reiterate myself. If I am doing it, why are you making notes? Why are you making yourself like a burden 12-hour, 13-hour study plan? And in the end, when you revise, I have given you power notes for the advanced file, right? So I'm giving you power notes also for the last minute revisions. So why work extra when I'm doing all the work for you here? Everybody gets the 5 pillars now? Is the strategy clear and crystal clear for everybody? Showing you the first week sample here. So this is on every week plan, I have given this 5 pillar strategy on the small window for you to remember and memorize and get familiar with this strategy. Watching daily classes, 2 to 3 hour self-study. Am I revising the live classes or not? Am I taking the weekly and monthly mocks or not? Am I solving my thousands and past papers for self-assessment? And am I going to the 95% on each of the resources or not? That's how Winspert scholars work and prepare this exam. So if suppose your first week is operative week, I'm going to work more on the design. This is what I could do in the last few days, considering I was tight on the time as well. I'm going to work more and enhance and make it more elaborate as well. So this is the first draft. I will be again working few hours more on it and then I'll upload it on the drive. So the old boring study plan will be replaced by this study plan. I want it to be more visual and more engaging with you on a regular daily basis because we realize you're looking at it every day. Let's make it pretty, right? So operative week, for example, the first week. So this is the watch party, the watching daily class pillar, the same color coding here. So you're going to watch these classes on the app. And if you go on the app, You go on the week 1, exactly same thing is already aligned day wise for you. No effort there to decide what you do every day, what you watch every day. Everything is given to you day wise here. And on the day 7, you see 2 quizzes, subject wise core quiz and subject wise mock is here. So on day 7, you go on the mock and you take the mock examination. You have the flagging feature. You have the missed question feature. You see everything that you have attempted, everything that is remaining. This is your exact exam style mock, which starts from the week 1. Every week would have that particular week's subject mock. You're seeing it here or no? Everybody is getting it clear. The week 1 is clear for you all. Every day, every classes, and on day 7, you get 2 quizzes. Please only take it when you have confidently covered and watched all the classes and you have done the self-study plan of that week. So that's your watch party and that is your weekly mock on the app. So this first blue box and this green box, you've done it from the app. Now, daily for 2 to 3 hours, you will study and dedicate yourself and cover these chapters from this book and cover these articles from the operative subject wise folder. So if there are about 28, 29 articles, daily 4 articles will complete it in that particular week. And when I say 2 to 3 hours self-study, yes, it is sufficient. So if you're doing 2.5 to 3 hours, I recommend spend only 20 to 30 minutes per article. In good 20 to 30 minutes, you can have a complete read of that article. Okay? Because you're not memorizing on the first read. You're just briefly reading. You will be reviewing it, you will be revising it at least 1 times or 2 more times. So this dark blue box is your self-study plan on that particular week. What extra book? I'm not making you do full books, but I'm doing certain important chapters which have a lot of clinical information that is applied in exam. So please no, don't go crazy on just Australian thing. Only 25% of the exam is policies. Only 25% of the exam is policies. Rest 25% is also treatment planning. Rest 25% is also what investigations to do. Rest 25% is also diagnosis and management planning. Yes or no? So 75% of your exam relies on the academic knowledge. You don't need to learn randomly. You need to learn in a researched and a knowledgeable manner. You need to have very strong knowledge and foundation of individual subjects' situations. Caries, prosthesis, periodontitis, gingivitis, or your other subjects, white lesions, red lesions of the mouth, systemic conditions having oral manifestations, all the individual disciplines, individual conditions, you need to know how to identify them, how to focus and find from the chief complaint what a likely diagnosis could be, reaching the correct diagnosis, based on the diagnosis, knowing what management may be required and not just from the conditions and the diagnosis your management planning comes. Your management planning comes by knowing the diagnosis, by knowing the prognosis, by knowing the patient's financial factors, by knowing the patient's social factors. Can you do management just by knowing what a diagnosis is? No, because if diagnosis is a cracked tooth, is the management always same? Based on the prognosis, you decide whether it's extraction, whether it's removal of the restoration, giving a temporary restoration, observing it if there are symptoms, right? Understood. Everybody, that management planning cluster requires the deep information and knowledge of individual cases, individual conditions. because management comes from the patient's social, economic, and your prognostic factors and your diagnosis. All this is learned in your thousands and past papers, because thousands and past papers only I'm teaching you different diagnosis and different managements going for it. In thousands and past papers, I'm teaching you different prognosis, how to reach a prognosis. In thousands and past papers, I'm teaching you if this is the diagnosis and this is the prognosis, then this is the treatment plan. Yes or no, please. You have watched some of the thousands and past papers now. Have you not seen that this is how it is getting covered? That is why the thousand and past papers will prepare you for that 75%, and the articles will prepare you for the unseen and new questions, so that even the new questions will feel that I know it. And then you will also come out of an exam. Really? Was it really new? Was it really difficult? No, I think I had covered everything. And that is why we got such high students clearing it, even in the worst of the history of the ADC examination, because we prepared the deepest academic level for this exam. So your articles will take care of your unseen questions. This daily 2 to 3 hour self-study plan and watching the classes from the app will take care of the seen and familiar questions. And your self-assessment on a daily basis, 30 to 40 minutes of self-assessment and reaching 95% in all these sources will make sure that in the exam you will not make mistakes, you will not go wrong, and your chances of getting accurate on each marked question will be extremely high. Revisions and repetition, I've given the 1.5x speed to save time hack also on the study plan. So in case you forget this class, I do not want you to forget this hack and continue doing it. Can you see on my screen on this purple box? This hack made it to the study plan, so it means something, right? It will save you so much time and yet give you quick revisions, quick revisions. Similarly for endo, every week's plan will follow, right? And the revisions will start as well in the week 15. By the week 14 and 15, entire syllabus will be covered. By week 8, all the subjects will be covered. So 1 to 8 week, you're focusing on subjects individually. 8 to 15 weeks, you're focusing on Mega Master file and Ultimate Advanced file revisions. By 15 week, every syllabus, every book is covered. And by week 15, you will also be starting revision of that. So you will not just be completing syllabus once, you would have completed the revisions also. And then week 15 to week 22 will be purely third revision stage, which is going to be so amazing and smooth. You will see, if you do your first 14 weeks right, the next 8 weeks become a breeze. So no matter how intense these first 10 to 14 weeks may look, this intense preparation, this intense program is going to get you be on top. That is what happened with our September 24 candidates as well. Despite only few handful making to the ultimate exam, majority were from our Winspert course. And I'm super honest, transparent, and proud when I say that. And I don't care what trolls say about it, because you guys have been on my group. I don't need to prove or justify. You have seen the speakers talk. 13 of our speakers spoke on that day, and they came in front of you with their faces on for you to, because a lot of them still didn't want, a lot of people might not want to do it, but they did it because they care and love you as well, and they consider you as peers and not competition, right? And we also should look at them as somebody, as a beacon of hope, that if they could do in the worst of the examination, the hardest of the exam, then definitely the March and September 25 will get better, because every cloud has a silver lining. There's always a rainbow after rain. There's always sunshine after rain. It is never always same. Yes, it's unfortunate that we were the batch we got stuck in this storm. Yes, we had to be that batch who had to take this financial and emotional burden. I feel it and I empathize and sympathize with each one of you. You know, every day from the last 4 days, I have been constantly online on my WhatsApp. You have seen me there. I may not be able to do calls with you right away, but yes, I have been talking to you all on chat on WhatsApp. So I know what is going on. I am there with you, not outside the field. I am with you. I'm inside. I'm feeling all those emotions with you. Don't think that I am not on that roller coaster with you and just watching you, Kavya. I'm there living it every day with you, but somebody in a position not taking the exam, at least I can see that beacon of hope in those 60 winners that we had and bring it to you and tell you, deliver to you the new strategy, right? Thank you, Aurora. And I really, really feel it too. And I'm telling you, I'm feeling all of it. It's not been easy receiving all these emotions of so many candidates. I'm also, and you know me, I'm an empath, so I absorb everything. It's hard for me to process it as well, but always what I do is if I get this bundle of emotions, I will always transmutate into something useful. If you know me, you would know that I will always take all the negativity in, I will take all the pressure in, and I will transmutate it and bring out something amazing for you guys. Tips on improving cluster wise is that you have to work on all the 4 clusters simultaneously. That has to go without saying, guys. I will not tell you focus on one, because then you in the next exam can miss out on the other. Because tell me, and I have seen it with my own eyes with students repeating their attempts. They got A in one cluster one time, and the second time they focused on the one they failed and they flunked the one that they got A in the previous one. This exam is so unpredictable. The cluster that you could be getting an A right now, but if you failed because of another cluster, next time you could flunk the same cluster that you got an A in. If you don't trust me, ask on the March 25 Study Buddies group. Type it there. Put on the September 24 Study Buddies group and ask them. You will actually hear from the true winner's mouth that this had happened in the past. Do not get obsessed with one cluster. You don't lack. I have now divided the advanced file, the ultimate advanced file questions into the cluster wise. So all the questions on the ultimate advanced file will specify which cluster they belong to. So now if you particularly know what cluster was your week, you at least would focus on that question. Okay? So Khadija, I think you got your answer. Najam, I think you got your answer. Now, when the ultimate advanced file will specify where each cluster, where each sub-question in an SBQ, which cluster it belongs to, and when you're preparing that and you're focusing on one cluster, you would know which questions usually you're making mistakes. Right? So this is how I want you to approach it. And this is how this all 5 pillars of winning strategy will help you get through it. The most wholesome way how you can achieve your dream still, even at the darkest night's end, there is always dawn. So these are the places, your app, your drive link. Somebody wanted to see where the subject-wise folder articles are. I think I showed it, but I'm going to show again. Just have a look here. This is on the drive where every subject-wise folder is. In individual subject, all the articles needed to be prepared are there. Okay? under the Winspert website drive link. There were no mistakes. The exam cutoffs were extremely high. You needed to be extremely on the top, maybe 5 to 10% of the entire lot. Remember, everybody, when I used to give you the mock examination and you guys used to score 70%, 75%, 80%, 84%? Remember? Even during the preparation, everybody was not at 90%. Was everybody in the same level? During the grand mock, during the ninja mocks, during the public mocks, we were having different scores, right? Let's do some introspection here. With every mock examination, I used to conduct a poll, and with every population size and distribution, this time, Lau, this time, Ashi, I'm just saying that if they kept the cutoff, suppose at 80%, and only 10% people scored 80%, and the rest were even if 78 and 79. So tell me, were you lacking, or were that even one or two mistakes and wrong questions costed you? This times the stakes were high. Your preparation was not lacking as much as the stakes were higher. Am I making myself clear? I showed you. That is why I take polls on the scores. Show you the distribution curve with your own eyes, that in the main exam also you all will not be getting all 90% correct. You have seen it in your own eyes, like even with the same preparation. Everybody says we all prepared the same way. Mostly this thing comes, no? We all prepare the same way. But when we take mocks, do we all get the same scores? Even during the program, when we say we all prepare the same way, so that means when you should take mock, everybody should get same score. But do we get the same scores? No, because the reception of information, the retention of information, the ability to critically think, process, and apply to an unseen question still varies individual wise. So how we can improve is we have to be on the top 95%. Everybody gets it? Now, what I'm trying to say is that you have seen yourself in with your own eyes that even by preparing the same way in the mock exam, when we are not securing the same scores, same will happen in the exam. So this time it was extremely hard, but it doesn't mean that March 25 would be equally hard, but it is unpredictable. So that is why while every course, we don't assume it to be repeating, we don't assume it to be easy, right? When you prepare for the hardest method, so anyway, if it gets repeated, it's easier for you, right? Am I making sense here? Am I giving you some clarity and some acceptance that it's not that you lagged, it's just that they took only the creamiest of the cream. The topmost scores only made it, probably. The cutoffs were really high. That is an explanation that goes with what goes on, and that is also a most probable explanation. Nobody knows a confirmed explanation for this. Is it right, guys? Now, going back to the five pillars, could be anything. That there could be they just could be rationing how many dentists this year. They might be taking some pause off, take the load off their system, because they also released a part 2 statement, and I shared it on the September study buddy group. If you remember, I shared a statement from ADC where they were restricting the part 2 seats also for the examination. Anybody here who saw it? So what does it mean? That the system is overloaded. The five pillar chart will be the part of the study plan. It will be uploaded on the drive under the Winspert website drive link. It will replace the existing study plan in few hours once I'm completed designing it. All right. So I hope the new strategy makes sense, gives you the confidence, gives you some clarity. Watch the success celebration class, guys, if you haven't already. Please watch it. You will learn so much from their experience. It will help you. I will be there every day to guide you, motivate you for sure. But do watch the success celebration on which was covered on Saturday. It's on my Facebook page still. You can go and watch it there. Any more questions? Please message me on WhatsApp. You know I will be there taking all your questions. And I can't wait to get started with you. We've already started. We've done 2 advanced file classes already. And we'll continue to meet now every like Wednesday and Friday we'll do advanced file. Also working on our extra infection control file classes, which I'll resume from tomorrow, which is Tuesday, right? So we are doing everything in our capacity, bringing you all the mocks and more and more and more mocks and more practice and more tests and more motivation and better elaboration, more simplification of the process, more color coding, adding more visual aids for you. I will start color coding the cluster questions also on the advanced file. I know the highlight method didn't work, but I have figured out another way. I'll work on it. And on Wednesday, you will see the newer, ultimate, beautiful advanced file. So I'm trying to do every day what I can do. Every day I'm improving myself, not blaming anyone for anything. Just continue to improve yourself. If I do not give up, if I want to still continue to improve, I never claim I am the best. I only crave and claim that I will continue to give my best every single day. And I don't say that I have reached the way I've reached. I am not the best yet, because every day I am getting better from yesterday. Every batch is better from the last batch. Every time my batch says, ma'am, wow, next batch is going to be so lucky, right? Because they will get this. And I'm like, because you were lucky too, because you got something new from the previous batch. Every batch gets something better. That is Winspert aim. That is my aim. That is my strategy. There is nothing else. So leave the negativity aside, cut it off, have a laser focus, and focus on your success, focus on your growth, focus on your knowledge base. Nobody can take your knowledge away from you. It's your best asset. It's your most valued treasure, which will remain with you all your life. What you learn at Winspert, trust me, you would have even not learned that in your undergrad university days. And I have had fresh MDS tell me that they learned more in the Winspert program, but they didn't even learn in their postgraduate days. This is the intention, to make you so powerful with knowledge that remains with you throughout your practicing career. Exactly, that is what I'm saying. Part 2 load also got so much, they had to put some barrier to reduce the number of the candidates this year, and this will get better. This will get better because everything does, right? Goodness always makes a comeback. So be good and good will come to you. Okay? Thank you so much, guys. I hope everything was clear. There is no age cutoff. If that is your question, there is no age cutoff. I've had students who are 50 years old and plus take this exam. Age is no barrier for this exam. Only your mindset, nothing else. That's all you need to go. If there are certain highlighted articles, please read the highlighted part only. If they are not highlighted, then just briefly go through everything and then you can make notes of that article. Thank you so much. You will get a better looking, better elaborated study plan uploaded on the drive very soon. Thank you so much for being the fabulous audience that you always are. I truly, truly appreciate you being so receptive, so understanding, and I must commend your strength, your bravery, your grace, your integrity. You have been so graceful. You have been so integral. You have been so, so, so strong, and only the best awaits you. Trust me, those who are tested the most are the ones who get blessed the most. Believe me, mark my words, write it down. I told you on 14th October or 15th, whatever the day, yeah, 14th October, that those who are tested the most are the ones who are blessed the most. And this is not the end yet. Your blessings await you. Your best is yet to happen. And best is not just getting the grades and a pass in ADC. Your life will be blessed. Your families will be blessed. Your peace, how you enjoy life. Some people, they have everything. They struggle with so much negativity. You know that? Some people, some of the mentors, they are already practicing in Australia and this they are crippled with negativity. You know that? So you think clearing ADC is the source of happiness, source of positivity in your life? It is not. Or does it make you a good or better person? It is not. What makes you a good or better person is your character, is how you carry yourself in life, what you do to others, how you look after your family, how your family loves you back because you're kind with them, you're kind to your peers, you're kind to your friends, all your loved ones. That is your true success. ADC is one fraction part of your life. One fraction. And do you think your entire life success will be gauged just by how well you did, or how many attempts you did, or how many money possibly you burnt on just for this exam? Do you think that's the only money you will make in thy life? Your family will be blessed. You will be blessed with greater blessings beyond this darkness. And you have shown grace. Let me tell you that. You don't have to hear it from someone else. I am telling you in the last 4 5 days how my students have showed up and messaged me and talked to me. You have been so graceful. You have taught me to carry myself during this time. You taught me more than I taught you. Right? So do not pause the classes. Please do not waste the time. Do not make the study plan longer than this is, and have fun while you study. It might be challenging for you and your family financially and emotionally at this point, but trust me, bigger blessings await you, right? And trust me, there are more successful and wealthier people who are crippled with negativity, and they have their own diseases in their minds, and they will go and do anything bad for other people. They have no ethical filters. So they are, that's what I'm telling you. Success has very different criterias, and we all will be judged based on our actions, not based on our bank accounts, not based on our number of attempts, not based on how we think we are. We will be judged, we will be given our blessing based on how we show up in the world. Yes, you don't have to make notes from the live, from the thousands and past papers and CVs and any classes. Please trust me, the power notes given at the end will be summarizing all that information that you need to take in the exam. Okay? Now, I hope you will keep in your head the true success meaning. Give yourself strength and know that Almighty is with you. Even if you didn't clear it, God does not believe in small victories, but He does believe in making your entire life victorious by giving you the strength of character. By sometimes He puts the obstacles in front of you deliberately because He wanted you to get stronger. Have faith, trust the process, and study. Put your head down. When everything around you doesn't make sense, put your head down and work hard. Keep moving forward. That's all. If whatever is happening around you doesn't make sense, you don't know what's going on, why it happened, why, leave it all. Get yourself in a bubble of focus, put your head down, work hard, and success will meet you face to face. Classes that will be covered on the Monday class, the topics of the new articles that will be covered on the Monday class, they could be either from the subject wise also, so that it helps you. They could be new also, because I am collecting a lot of new ADA articles, because ADA is focusing on a lot of new concepts in conferences. And last time also same thing happened. Remember, the question came in exam about the SDF usage in elderly patients, right? So GIC and STF use the SMART technique. And remember, while preparing in the September 24 course, I had put the SMART technique question in the mock exam also. So that was created by the inspired by the ADA conferences. So this time I'll try to bring more and more topics from the ADA conferences, so that more and more newer concepts that get asked in the exam, you're already well equipped and, to face them. My research is on, and your hard work should be on. That's all. And when we meet together, we will get brilliant scores. Now you have to make sure that your mock scores should get higher, your self-assessment scores on thousands and past papers, and your Mega Master and advanced files should get higher. There is just one study plan, Ikra, which is going to be on the drive. There is no 5-hour, 3-hour, 2-hour, 8-hour study plan. There is one study plan only, and it can be done in your complete focus within 6 to 7 hours. If you have missed some part, Ikra, I think you joined late. I just saw you entering the class. I think you've missed the most of it. Please watch this recording on Facebook again. Okay? Yeah. So you missed a lot of things, Ikra. Please watch the whole class and you will get it. Thank you, Ratul. I hope you got the hack now. Don't pause it, and 1.5 exit when you're revising it, and you got it. So everybody, it's a fresh start, it's a new day. Please leave your tears behind. I have left them behind myself too, and we are ready to face the new batch, the new course with a smile and strength, and let's start afresh. Okay? I'll see you on Wednesday. We do from page number 11 to 16 on the Ultimate Advanced file. If you have missed those classes, please, they are on the app, under the Ultimate Advanced file section on the app. Watch them and be prepared for the next live class. And I will work my magic on the coloring and cluster-wise, a lot of work for me, because the highlights didn't show, such a shame, on the drive, but I didn't know. Only I uploaded it and then I saw it all come in yellow. So I have figured out another way. Don't worry, I'll rectify all of it. And yeah, I'll see you on Wednesday then. Bye-bye.